Teasing. All right, what's today's talk on? This is neat. I like this. You know why I'm sitting down? Because we're talking psychiatry. Did you guys ever see a psychiatrist? You don't have to answer that. Let me tell you a great story. This is fun. I trained in Baltimore at Shepherd Pratt Psych Institute. That's where I did my psych, okay? So it was a 6-week rotation, and I had good friends up in Erie, and I had already planned to go skiing up in Erie for the weekend. So we finished at 12 o'clock, and we're walking out to go to the cars, and the guy's name was Dr. Gold. He said, Coppola, I'll see you at 1 o'clock. And I go, I'm going to Erie. You know, I'm not in psych. And he goes, it's a workshop, we need volunteers. Thanks for volunteering. And so I ended up having to go to this workshop. I almost became a psychiatrist. Trust me, guys. If anybody has had what's called psychoanalysis, and that weekend, I had it done 6 times too, okay? It's remarkable. It gets into what's called your psyche, which is a part of your brain's makeup that protects you. And what's remarkable is they have a way to get in. I can tell you how it started. You have to lay on a couch, which is classic, right? That's why I sat down since we're talking about the subject. And they say, okay, we're going to do word association. We're going to say a word, we want you to say a word. And so we start, and the guy goes, all right, Coppola, if you're not going to do this right, I'm telling Dr. Gold. Because if you stop for a moment, then you're thinking. Does everybody follow me? So word association, doing it the way it's set up, as you say what you say, that's what gets them in there. And when I say them, these are trained psychiatrists in the therapy to get in to do the psychoanalysis, okay? So, geez, that was just in 1982, and it was remarkable because I was upset I couldn't go to Erie, but it turned out to be the best experience in my life because it enables you to assess your thoughts, your ideas, your thinking process, how you associate things, and compare them to what, quote unquote, the doctrine is. Okay, so today is the awareness of mental health. And for me personally, I wasn't aware, and that's why I want to make you aware by what we're going to talk about today. And I want to set it up first and foremost. We will do some stuff and talk about certain disease processes, but remember, this is the awareness. So I might not go into detail of depression or bipolar or schizophrenia, but we will talk about it to get the awareness of mental health. Now, the statistic that got my attention to start this, and then ultimately my new experience that I had, was kind of frightening. In 2022, 56% of women in America had a mental health visit that was new. Let me see what that means. Not that many percent of American women, had mental health disorders or whatever, but they had a visit, okay? And everybody said that came from COVID, all right? So we'll put on this COVID. But let me show you another one. Again, all data from Forbes Medical, if anybody wants to look it up. 2022, ages 18 to 26. 52% of females took medication. Okay, guys, again, this is COVID. Everybody with me? When did he give you the data? It's over 50%. That's a large number. COVID had a big impact. We're gonna go with anxiety, depression, PTSD, bipolar, and schizophrenia. I'm gonna spell it wrong. You guys get the point. I'll do what I always do, scribble. All right. This brings me to why I got to the subject and wanted to talk about. I've been a physician practicing since 1990 in primary care, and I never realized what we didn't have for our children in Pennsylvania. And again, guys, when I go through this stuff, the personal component of it is to make the point, you know. And so what happened is I have a brother who had a son, so my nephew, and had a problem. Lived in Erie. Had to go to Ohio. Does everybody follow me? We don't have the services for our children. We still don't. And so what occurred was, made me aware. Got a taste of it. Kept it in the back of my mind. I've closed, I think we're up to 7 hospitals now since I started practicing. And I'm only smiling because it's a shame I smile instead of cry. Because I've witnessed them all happen from St. John's all the way through to they just closed down Kennedy. You know, they still have emergency services and some services there, but they shut down. I used to have census of 30 people over the weekend. They don't have that now. Does everybody follow me? So what happened, I'll come back to this slide if you will. The hospital changed from med-surg to now we do adult psychiatry and gero psychiatry. Okay? And we have an ER for intake for crisis. Okay? Before they shut down the hospital, myself and my partner, Dr. Ali and Dr. Jagiello, covered the hospital for patients that came to the hospital without a PCP. Does everybody understand that concept? If your PCP goes to the hospital you're in, your PCP takes care of it. But if your PCP doesn't go to that hospital, then they have to be cared for by somebody else. They call it a hospitalist service. And we ran that service since, it's been a while, guys, early 2000s. And like I said, it was busy. I used to have 30 patients to see every day, ICU, CCU, step-down units, they had everything. They did cardiac caths and everything at that hospital. Well, this started probably 2019, pre-COVID. Is everybody with me? Oh. I'm trying to think of the year, 1988, Dr. Fatty Gaddy. Anybody know Mario Fatty Gaddy? They had a restaurant. It was great. When I did the rotation with him, we ate at the restaurant every day. That's why I'm fat. That's what happened to me. But anyhow, bottom line was, he was the one that brought me into the psych units for the first time, and they had a psych unit at St. Francis. So I was trained and understood it, but didn't have much experience until 2019, when they shut down the hospital and they made this a crisis center for adult psych, so that is anything over 18, and geropsych, which is over 65. Well, sometimes it's like 60 years old. If they're busy, they'll let them in over on this side. Both units have a capacity, probably about 70 patients. Okay, is everybody following? I'm setting it up so you see I'm speaking to you from experience. The DSM-3 and the different texts that are out there to tell you about all these diseases, this is all about awareness of mental health, because I wasn't, okay? I want to show you in a way that you can appreciate, and I'm going to put here drug and alcohol rehab. Again, guys, just trying to set it up so you can follow my thinking, okay? When I went to work with Dr. Jagiello, my partner, who is a board-certified drug and alcohol specialist, and so I cover him. And so when I first went there, it reminded me of this experience. Like, I didn't understand this. And so when you get to understand it, you'll find that everybody knows somebody somehow, whether it's a friend, family member, whatever, who has somebody that has substance abuse. And the substance abuse destroys the family. And it's a big family, even if it's friends or what have you, okay? It doesn't have to. And that's what I've learned through the process. And what we find is our statistics showed us that the gateway drug to opiates that cause all of these problems, the fentanyl and all the stuff we hear about, is what? Marijuana. And what's the country doing right now? Making it accessible to everybody. We know that. Does everybody follow me? That's why I'm getting that. This is an awareness, and I'm giving you this as an example. Because what you find then is where the money goes. These people that have this problem, we pick them up at their house and drive them to the clinic to give them the medicine and drive them back. Does everybody follow me? Just bringing up the expense. All right, that's the analogy so you guys can appreciate. I didn't know anything about this. And when you do an intake, you ask the person, what's the first time you got high? And on what? And some of the older folks, like maybe the ones that are in their 80s or early 90s, theirs was probably alcohol. But once you get a group of, say, 70 and under, 98% is marijuana. And that was the first time they got high, and then they followed that high because they liked that high. Does everybody understand the concept? All right, guys. So you see how in 2019, I was exposed to an inpatient unit. And what I found remarkable, and again, we'll put these on here, the anxiety, depression, PTSD, bipolar, and schizophrenia. And I'll give you a real quick so everybody understands it. With schizophrenia, you don't have a reality base. What does that mean? We're all standing in the room, listening to the doctor talk about mental health. If someone with schizophrenia, they might think they're in a different place. Yeah, they might think they're in New Jersey. They're not connected to the reality of this moment, where we are, what we're all doing. That's how you want to think of schizophrenia. Bipolar, I put up and down. There's highs and lows. What does that mean? When it's low, it's very low, very depressed. When it's high, binge everything. And so you try to balance that out. The PTSD trauma, and you can't imagine, is all I can tell you, is what I see. You can't imagine what people go through. It's phenomenal. The depression and the anxiety, both of those have effects that if you don't treat, could lead you down a path that you don't want to go down. And they have the potential that if you do treat for a long period of time, you can run into problems as well. The reason I bring that up is this is our number one reason for admissions to both places, the gero and the adult. Right, this is 18 and up, and we'll say greater than 60. And what does this lead to? It's called SI. Anybody heard that expression? Suicidal ideation. So what that means is that the person that we admit has gotten their anxiety to the point or their depression to the point where they've actually thought of taking their life. And what occurs is, if you don't treat it every time as a crisis, you miss one. And you don't ever want to miss one. And I have to say, we in Pittsburgh do excellent, and as a country, we do well with crisis intervention. But you have to make the call. And that's part of what today is about for the awareness. Does everybody follow this pathway? I had to set that up so everybody can appreciate that just like I said with the drug and alcohol, out of sight, out of mind. I never was in a drug clinic or did anything as a physician when I was practicing. And then once you start to do it and you see it, these are people. These are real people that had bad experiences and got themselves to the point where they got addicted to a substance, and they're doing their best to get off the substance, and they're working the program to get off the substance. It's the same thing with mental health. And there's so many more we can get into with this, guys, but what I really felt best was to understand this is where we see the most, and then with that, the suicidal ideation is what's frightening to me. I have a son who just turned 34, and he has 32 friends that have committed suicide. By the response, I see you're all the same as me. Because when I saw it, I could not believe it. And then it was amazing what happened. Friend of the family. I can give you the connection so you can appreciate it. My father was a physical therapist that took care of this family's mother who had a stroke, and then she died. This person's sister was a nun, and she got one of the nuns to leave the convent, and they had another family. So long story short, we were all close, because my father did therapy. Every holiday, they were into produce. Every holiday, we got a fruit basket and some Dago Red, and every way we sit around and have fun. So you get to know each other very well. So I get a call. Unfortunate situation, the youngest brothers got a divorce, and his son was in California. When he turned 21, he came back to Pittsburgh. And the father said to him, I'm going to McDonald's, what do you want? He goes to McDonald's, comes back, said, hey, come on down, get your sandwich. He goes up, he hung himself. And this is a personal, I know the family, I know the situation, I know everything about it, and I didn't see it. And so a brother says to me, do me a favor, I want you to take my son out to lunch and talk to him. I want to make sure that none of this stuff's in his head. So his son at the time was 20 years old. He was at Robert Morris. He's an accountant, but he wasn't done with school at the time. And so I just took him out. I learned that some steakhouse has good chicken wings. I can't think of the name of it right now. But anyhow, I took him out, talking to him. Blown away, guys. Blown away. 20-year-old, good-looking kid. And I asked him about his love life. My grandmother used to ask me that all the time. So while we're eating and stuff, I said, you know, hey, how's your love life? And he went, pfft. And I go, what, a good-looking guy like you? So he tells me a story. He's at a fraternity party at Robert Morris, talking to a beautiful girl. They're sitting on the couch, and she excuses herself to go to the bathroom. He said, we'll get a couple beers. Gets the beers, comes back. She's not there. He goes to the bathroom, door wasn't locked, and she was standing up urinating. She was a he. Okay? So then I know he spends time with his grandmother in Uniontown. So I said, well, go spend the summer with your grandmother. And he goes, no, all the girls wear long sleeves in the summer. I didn't know what that meant. That means they're shooting dope. You know, so you end up in a situation where this is our community, guys. They live right down the street, going to Robert Morris School. You can't imagine the number of college kids that get admitted. And just the fact they're thinking of suicide, with all the suicides that my sons knew of, I tried to look into it. There's websites for suicide that start off by saying the successful, I forget what they call it, the successful suicide journey or something like that. And you know how they do those claps on the screen? Like all these people are clapping as if they've accomplished their agenda. Again, guys, we have to be aware of it because I think the oldest one of my son's friends was 26. You know, and it's just so sad because did you know that stat? I didn't know that stat. I didn't realize that there's that many suicides in America. All right, so now let's get into the medicine and being aware, okay? What I like to put is my brain, well maybe not my brain, but a brain, spinal cord, everybody knows, frontal lobe, temporal lobe, parietal lobe, occipital lobe, and we'll put spinal cord. And then we'll put a big circle in here with a T for thalamus. And what happens with mental health, I'll put issues, and they call them conflicts. They is the psych community, okay? So we're all born at birth, everything gets developed. And I'll never forget, my father used to always say, the first 5 years of life is where your brain gets developed. And I remember him just saying that. I just remember those years and him talking about that all the time. And what the child gets exposed to in those first 5 years of life kind of imprints on the brain. Just fact, okay? So what happens is we go through, I like to put toddler. You know, infant, of course, all the way from birth to the toddler, because they're curious, okay? When I was at Shepherd Pratt, we spent 2 weeks at a preschool. What was her name? I can't think of her name right now. It'll hit me. Oppenheimer, Dr. Oppenheimer. And there was a 2-way window, okay? So that you could see the whole facility and you could see the cars pulling up. And the first day we went over what we were gonna try to observe. And she indicated the exit from the door of the car tells you what that child's gonna do all day. It was remarkable. The ones that got a hug and kiss from mom or dad and a send off of, let me see what you look like, you know, fixing the hair, perfect, everything was good. The ones that you see them yelling and the door slamming, hit somebody before, 10 minutes went by. And it was remarkable because she talked about whatever they were exposed to before they got there. At that age, they can't leave it at the doorstep. So it becomes a part of what's gonna happen that day. And she taught us about receptors. Everything has a receptor. We'll draw a cell, put the nucleus in the center. This is the cell wall, and we'll use sodium and potassium. Go in and out of the cell. But they have to have a receptor to get in and a receptor to go out. Everybody understand? And it happens faster than we can imagine. Milliseconds. Fast milliseconds, it happens. This process all goes in the brain. Goes along in the brain. Where's my brain? And that's how all parts of the brain, I'll just put dots. What an artist I am. Okay? And this occurs constantly, Everybody's thinking like, this is boring talk, I can't wait to go to lunch. Or maybe you already ate lunch. But the point is that we all have thoughts and ideas and they're always going. Okay, that's just who we are, how we are. And they're called synapses. Those synapses are constantly going, constant. And it's your memory banks keep control of the memory, but they make you aware from memory what you're surrounded by, whether it's good, whether it's bad, whether there's a conflict, whether there's an issue. So this process of receptors, I'm spelling wrong again today. What can interfere with the receptor? Chemicals. What kind of chemicals? Did anybody ever hear about low birth weight? I don't know, how old am I? Let's say 60 years ago. Did they tell the mothers that were pregnant 60 years ago, don't smoke? It'll cause low birth weight, okay? They changed culture. So what happens? Mothers found out that if you take in all the nicotine and all the additives, that your child can be developmentally slow. So they advise no tobacco products during pregnancy. We understand that concept, all right? So what has happened? You see the data, and I gave you some of the numbers, especially the 18 to 26, the amount of depression people get on medication, okay? Is that good or bad? I'm not the psychiatrist. I would assume if the psychiatrist makes that determination that they need medicine in order for their well-being to continue to do what they need to do, they do it. What I want to make sure of, though, is one of the things that hits in the child, I'll put children. A big thing we're seeing is ADHD, okay? And again, personal experience. I thought it was good when I had 6 children, all close in age. You put a video in, and you got, if it's an hour video, you got an hour apiece, right? You can watch, like, do whatever you needed to do for that hour. Well, now, I wake up in the morning, I got a 3-year-old and 1-year-old granddaughter, right? So I come down the steps, and I say, morning. They don't take their heads off of their iPads. We used to read the cereal boxes. No, they're watching stuff on the iPads while they're eating breakfast. And I think of that like, okay, what is it doing? It's stimulating the mind. What is it doing stimulating the mind? Whatever goes on. But this ADHD that, I'm not a psychiatrist is all I'll say, but they're hit with so many things. Like so many things are coming into the minds of our children, especially the young children. Like I said, 1-year-old and 3-year-old. And I got like, get away from me. And it was somebody singing, you know. Reminded me of Sesame Street, like maybe a character like that. And they both had different ones, you know. And one sitting, it was like corner. One sitting here, one sitting there. And they didn't look up. I mean, that's what, like I'm thinking, you haven't seen me in how long? And I come down the steps and say good morning, and you don't even look up. And then the one says, Pappy, I heard you, you know, after I said it a couple more times. So again, guys, the stimulus that comes in, what is ADHD? It's a process or problem, and I've had patients and I'll put concentration. Again, it's not textbooks, guys, it's what I see, okay? The last one I had is a person that goes to college in Manhattan. They live in Fox Chapel. He has a brother that's younger. His father is an engineer, and mother is an MD, okay? And when I first talked to this guy, he wanted me to prescribe ADHD medicine. Like he came in to see me as a new patient, and he wanted me to prescribe it. And, you know, we talked, and I was amazed at all the things that he coordinated. You know, he also was excellent in math, so he tutored people for money at school. You know, so the guy impressed me with all the stuff he had in his mind, and I didn't see from my end the diagnosis. So I just asked him to see a friend of mine who's a psychiatrist, and as it turned out, the psychiatrist did give him the medicine, and everything's working out well for him. But what I found was talking to him, no sports, no girlfriend, not that he needs a girlfriend, I should put SO, SO. Video games, he did, like I said, tutoring, sleep, and medical marijuana card. 24-year-old, by the way. All right? Now, why I bring this up is what I'm seeing every day is college kids with a lot of things on their plate are thinking of suicide. I mean, we have, like I said, there's 70 people on the floor, and it usually runs full. And we've been doing this now since 19 for me, so that's 4 or 5 years. And I see this volume of people that have suicidal ideations. And then what's interesting is when you talk to them, you don't find that they have downtime. You find that they're like doing a whole lot of things all the time. Once again, guys, this is an awareness. Okay, this is the whole idea of today is mental health awareness. And what I want to make sure everybody realizes is that concentration, number one. What does that mean? If you have anybody that you have concerns about with mental health, ask questions. And however you know them, what you would know. If you're an aunt, did they remember a vacation time or something? You know, however it is that you have a relation, concentration is the first thing that changes, okay? And what that means is something that you're exposed to all your life and you've done all your life and you're capable of doing, and now all of a sudden you can't pinpoint whatever it happens to be. That, you know, used to be right at your fingertips all the times, and now you have to concentrate in order to get it. What does that mean? That means that if, let's say it was a vacation place that you went and it was a beach house in New Jersey on the water, and you were trying to think of what the name of the neighbor was. You have to concentrate in order to get back to that thought and be able to place what the dialogue was that you normally remember. Okay, so when I talk about concentration, I mean, we all had the Uncle Joe that doesn't shut up and remembers everything that happens 40 years ago. All right, that's one end of the spectrum. On this end of the spectrum is the one that doesn't say anything, you know, just sits there, and you ask him something. Hey, like, Uncle Joe, what do you know? Nothing. You know, they give you one-word answers. You know, my father used to always say, those are the ones you're worried about. You know, the ones that talk all the time, they have nothing better to do. But what it comes back to is we all know how people are. When we see a change in how they are, it's always good to ask questions. What does that mean? I think I told you guys. My grandmother, sad. She got mugged in an alley, and they took her to the hospital, and they gave her Motrin, 800 milligrams of Motrin, to put a hole in her stomach, and she died. And I didn't get to see her because she was in another place, but we talked on the phone before she was going in for surgery. And the last thing she asked me was, she always called me Matthew. Matthew, how's your love life? You know, always said that to me. And so for me, whenever I would see her and she wouldn't ask me that, that's how I knew something was wrong. That's my point to mental health problems, guys. You know the person, and the person has mannerisms, characteristics, whatever you want to call it, but that's who they are. If you see a change in who they are, please inquire. And if you're not friends with that person and you don't want to be intrusive and you don't want to do those kinds of things, pass it along to somebody. You know, somebody that does know them or somebody that does interact with them. Like, hey, has Joe been different? Have you seen any difference in Joe? Everybody understand concept? All right, now the other thing is, what I want to share is be certain, how would I put it? Cancer, certain diseases, not talking about it. My mother had colon cancer and no one knew until probably the last 10 years of her life because she didn't want anybody to know. And then she got okay with it, and it was okay to let everybody know. That's just culture, okay? And right now where we are, we're not talking. You know, I gave you some of the stats, guys. This is something 1 out of every 5 women in America will experience, and they call it conflict or crisis. What does that mean? Does that mean you have to go to the hospital and you have to be in a psychiatry place? No. All that means is that whether it's anxiety, whether it's depression, whether it's something that happened in your life, it happens. That's just the way it works, that something's going to hit you, something's going to trigger you, you know, and you can't stop it. You can't stop it. I remember when my mother passed, my brothers and sisters were like, you didn't shed a tear for Mom. And it was like, well, I can't make myself cry. I don't know what happened. You know, like, I loved her. Everything was good as far as I know. And then one day I was up at the where she was buried with my kids. And boom, it just, you can't stop it. When the emotion hits you, it hits you. And what we have to pay attention to is the emotion. What's emotion? Your feelings. Are they personal? I probably spelled that wrong too. Personal, we'll put down here is, who do you talk to? And then the big one is, when we talk to somebody and they leave for whatever reason, move out of town, pass away, or whatever, how do you replace them? That's a big factor too that I've seen. For me personally, it was my father. You know, he always said, you can tell me anything. Until you told him something, then he'd say, you know, he'd go crazy that you told him. So I was lucky my grandfather was still alive. So I could tell my father everything, tell my grandfather everything. But bottom line comes down to, you have to have somebody you can confide in if you need to confide into somebody. You have to have somebody that you consider as a friend that you can talk to, and make sure everybody realizes that there are people 24/7 that are experienced and can talk and want to talk. Believe me when I tell you that, guys. It's like I said, when I got into the drug and alcohol rehab, I had no experience, and so you have a hard time dealing with somebody that lies to you, because all addicts, when they start their recovery, will lie to you. But then eventually, once they get to a certain point in their recovery, then they know what they've done and they talk to you about it. But my whole point comes back to, you have to be able to realize that 24/7 there are people to talk to. And the best way, especially for you guys here, just call the front desk and say that the name that you want to ask for all the time is the crisis center. And once again, does that mean it's a major problem, you're having a heart attack? No. That's just what they call it, because it's a 24/7 service. And you call, you'll get a professional, and that professional will just talk with you. They don't try to pull anything out. They're not going to say, you know, we're going to do word association with you to try to get what you're thinking. They just will talk to you. And a lot of times that's all we need, is to have the ability to talk to somebody. All right, now, what happens is when we find out the problems, we call it a stressor. And what does the stressor do? Change life. And it's amazing, because over here, I also run the Encompass Inpatient Rehab Unit. So we'll see people that have like trauma. I'll put trauma with fractures or stroke. And you watch that recovery. And over here, you see emotional. I'll put non-compliance, because that's big. They're on medication, and they decide they don't need the medication anymore. And again, it all goes back to a stressor. I'll use a case I just had last night. 44-year-old female, married for 13 years, has 3 children. She just took a new job that's very stressful, and her husband walked out on her. Okay? And she had trouble when she was in college with panic disorders before testing. So she hadn't had anything since she was like 19 years old. And now at 44, she's in this situation and afraid she's going to lose the job that got the promotion, that made her not worrying so much about her husband leaving her, because she could at least take care of herself. Now she's worried about that. And I'm just a medical guy. You know, I just come along, make sure the blood pressure's good. If they have diabetes, they fix that. But you always ask them, and then you listen. And that's the point to, everybody wants to talk, but no one feels comfortable talking. So the environment has to be one where sharing and caring, that's what they call it. And it's an environment that, it's like the first time I took a friend to an AA meeting. You know, he now runs them, but this is 38 years ago. We went to a place, and you know, you walk in, you get a cup of coffee, you sit down, and he just listens. And people get up and run the meeting, and they talk about things. And you eventually, you get to the point where you understand by other people telling you what they're going through, what you may or may not be going through. That's the same environment we have in the units, where based on whatever happened, I gave you the suicidal ideation. A lot of it could be aggressive behavior, inappropriate sexual behavior, and usually what happens is those are the people that have the schizophrenia that aren't connected to reality, and they stop their medication. On their medications, they're fine. They stop their medications because they feel fine, and all of a sudden they're in these situations. And again, when it happens, we have Pittsburgh is perfect. We have the crisis center. They come in, they get evaluated. If we can't handle them, we get them out to Western Site. It's kind of like if you go to Swickley Hospital and we find that you have a 5-vessel problem, you're going to get sent to Presby or AGH. It's the same thing. If you go down to the crisis center at Kennedy, they evaluate you, and if it's over their head, you go down to Presby. Or actually it's Western Psych affiliated with Presby. So the network is in place, guys. All right, now here's the part that's the most important to understand and recognize, again, because we're talking awareness. A, it's everywhere. And B, it's treatable. And part of why we're in a problem, I'll just give you a real number. I don't know if I can draw so many zeros. This is supposed to be 500 billion. If I did it wrong, that's what it's meant to say. I wasn't an accountant. That's the expense, by the way. With lost work and expense of taking care of the patients, that's what it's costing. So the reality is, it's affecting us in many different ways. You gotta be aware of it. You have to pay attention to it, okay? And then C, the big one is, changes are increasing the problem. What does that mean? Look up, as I told you, the data comes out of Forbes Health, and look up the statistics on the LGBT community. It's unbelievable. Like 60-some% of them go through depression. I mean, it's unbelievable. And the reason I bring it up like this is, like, there's more to come. I can remember talking with everybody years back about we never saw diabetes in children, and then all of a sudden we saw it in 85, 86, and it was directly linked to fructose corn syrup that from 1983 was in what? Candy, cereal, soda, ketchup, everything we used. And now all of a sudden we're seeing it in children. That's the whole point to the problems that are coming that are going to strain that number are going to make it so that our units aren't going to be there. It's all going to be telehealth. It's already happening that way. And telehealth is okay, but remember how I told you they get well. It's being in a room like this and everybody talking. And everybody sits in the circle, and when you first get there, you don't say a word. It's just like when I took people to the AA meeting. But eventually what happens is they say something that rings a little bell, and then you open your mouth and you talk, and it stimulates somebody else, okay? So remember, the changes that are coming, guys, are in front of us. Now, what do we treat and how do we treat? So mental health awareness, treatment. I'll put depression. Good story. The guy's actually a business partner of mine. We'll call him Joe. Okay? So Joe gets COVID. Then he gets COVID again. This is in, what are we in now, 24? 22, end of 22. And I don't see him that often because he lives near Monroeville. But we get together at least once or twice a month. Okay, so long story short, everybody says Joe's different, Joe's different. So I check him out, Joe's different. I wasn't his doctor, okay? So it was in 23, so maybe a year goes by, his doctor retires, so he comes for me as a patient. Long story short, he was on a non-selective beta blocker that can affect the mind, okay? So we stopped that medication. And again, long story short, he wasn't getting much better, and all of a sudden his sugar was up. So I said to him, by the way, he had Medicare. That's how we were able to do it. I said, I'm going to put you in Kennedy Hospital, check you head to toe, and if there's not a problem, I'm putting you in the psych unit because I think you're depressed. And he said, I'm not depressed. Like he would get angry saying he wasn't depressed, okay? So I put him in the hospital, scanned head to toe, and there was nothing wrong with him. So I said, you're going to the psych unit. And he got so upset. He was a Marine, right? And I go, I'm telling you, this is the hardest thing you're ever going to do, but it's the best thing that's ever gonna happen to you. So I didn't know the rules. I worked there just as the doc, I don't know the rules. So he walks in, he's wearing suspenders, has his cell phone, has his keys, and they're like taking all this stuff off him. You can't wear a belt, you can't wear suspenders. Like, it was just amazing, the rules. And he's looking at me like, is this what it's gonna be like, okay? He was there 2 weeks. At the end of the 2 weeks, he was a different person. And what was neat was, because he was on the beta blocker for so long and it blocked the ability of the brain to function, you know, as quickly as they wanted him to, they put him on a medicine called Ritalin. Ironically, for ADHD, a lot of the treatments, but they put him on Ritalin and then they put him on Zoloft. And over that 2 week period, everything came back. He was the kind of guy that if you were out with him, say with 8 or 10 people, he dominated the conversation. He was always telling a story. He wasn't doing that. After he got out of the unit, he's doing it again. So what I want to make sure everybody understands is psychiatrists and psychologists know what they're doing. They're excellent at identifying the chemistry of the brain and how it works and what you need. And what you need to do is get the professional help. Always get it through your PCP. Yeah, I'm a PCP. I know the docs that I use. Unfortunately, nowadays you got to ask what your insurance is. But I know people at the Allegheny Health Network. I know people at the Swickley Network. I know people at the Passing UPMC. And we haven't started seeing all of our patients up at Swickley, but once I get everything settled, we'll be going up to Swickley as well, because they shut down Kennedy. So that's what they do to you. When they shut down Suburban, they stuck us down at AGH. So they still want our patients, so they want us to go up to Swickley. That all being said, guys, what I'm trying to make sure is give everybody an awareness of mental health is necessary, mental health works, you have to take your medication, and you have to see a professional. Make sure you see a professional. How I handle it, for those that aren't my patients, is if you've seen somebody and you've already had all this put together, then I have no problem. It's funny, it's like I tell the story. I saw 200-year-olds this a few months back, 101, 103. And I asked Helen what her secret was. She goes, oh, me and Jimmy are good friends. I said, Jimmy who? Jimmy Bean, okay? So I write an order so she could have a shot of whiskey every night. And the nurses are calling me going, Dr. Coppola, I don't want to lose my license. I can't do that. I said, she's 103 and she's been doing it for 30 years. You know what I mean? It's not going to knock her out. But my point is that where we are, how we get there is important. The medicine that you're taking can all have side effects. We call it a drug holiday. Any of the medications that are being given, even the psychiatrists will do it. They need to do it and monitor it. You can't do it on your own. You can't decide, like, I've been taking, what's a big Prozac? I've been taking Prozac for 22 years, and you know what? I don't need it anymore. Boom, and then you stop it. You're gonna have side effects. You can't do it on your own. Your PCP can help, but it's always best to get the professionals. All right, so let's go over the big one that I think is important. PTSD. I put here real big, talk. There's support groups, and sometimes they're no good. What you want to do is reach out to the best service that's out there is social service, and all hospitals have it. So you call your local hospital, tell them you want to speak to social service, and you tell them that I referred you there. And what you'll see, guys, is I'm on everywhere. You know, we're independent. I have 2 boys coming back, so that's why I'm staying around like this. But still, we go everywhere. So we have the contacts at all the hospitals, and so does social service. So I'm telling you right now, any problems that arise, you got someone to speak to 24/7, and you have to talk. The other thing is, you know your friends, you know your family, you know how they are, you know their characteristics. You need to make sure, if you know anybody that's been into a tragic situation, they need continued support. What does that mean? They can't stop seeing, usually it's a psychologist. Can't stop. And if they don't tell you about it, you don't ever ask them. You know, that's something that's personal. Bipolar, medications are difficult on the patients. They use a lot of lithium, they use a lot of anti-seizure medication, and there's a lot of side effects to those medicines. So when patients feel that they're better, they like to stop the medicine or play around with it. And then they miss their follow-ups. And then you have horrific situations. I just recently had a patient that she used to drive everywhere. And she quit taking her medication. She had a car accident. They took her license. Her brother, who she lived with, worked. She didn't get out. She went right down, passed away. You know, so what happens is you gotta take the meds, and you gotta, if you know of people that aren't taking their medicines, please push to coordinate all that stuff with their PCP, because they can always handle it, meaning they can talk to somebody. All right, now the schizophrenia, if you don't, I can't spell it, so I'm scribbling. If you guys don't know anybody and never seen it, that's okay. But if you have seen it, so important to take medication, so important. And as soon as you see a change in behavior, you have to make whoever the person is taking care of them aware, because it can get out of control. It can just escalate so fast, because remember, they're not in the reality. You know, like I said, we're sitting in a conference room or assembly room talking. If they were sitting in here, they would think that they're someplace else doing something completely different. So it's just, they're not in touch with reality, and it can change rapidly. So please make sure, medication-wise, if you know people that have any of those problems, continue, we call it, like if they get to the point, we call it compliance. If they get non-compliant, it's terrible. I can't spell, sorry about that, guys. You know what I said though. All right, last but not least, you guys are happy. The best way to describe it is, because I did it, because I went and did those when I was at Shepherd Pratt, and I was psychoanalyzed, and you do find conflicts that you didn't realize, like it's not even in your mind, you know, that's your body's defense mechanism. That's how you deal with things. So if something's on your mind and you don't want it to be, you put it in the back of your mind and say you're not going to think about it. The problem is, it's still in the back of your mind and you still think about it. Maybe not as often as you did when you put it back there, but it's still there. Does that mean everybody in here should go see a psychologist that does psychotherapy? No. But I'm telling you, because I did it, that I would say it's such a, like, you just feel better. You just feel so good after you do it, because it's like taking a test. Like I said, when it started out, they yelled at me because I was thinking of the word I was going to say when we were doing word association. You just let them talk. And before you know it, your mind is, I think I was like, they made me think about a time that I messed in my pants and I blamed the dog by the fireplace. I think I'd have been 3 years old. Like, they bring you back to vividly remembering that. That's their capability when they do these things. So again, find what you need. Know that everybody, remember the data I gave you guys, you know, COVID hit that a lot, but still 52% have had an impact in 2022. That's a lot of people. So chances are we all know somebody, or chances are we're all going through something. So what you want to make sure you pay attention to is be aware of it, because it's going to cause somewhere down the line, if you let it go. I had a brother that drank too much alcohol, and we all tried to intervene, and we all were dragged into things that we didn't want to drag into. But as we all talk about, you can pick your friends, not your family, and we love our families no matter what. And so you see how it tears things down. Mental health is the same way. We're not talking about it. It's like cancer years ago. No one's talking about it. And I didn't even get into the LGBT stuff, guys. It's just an unbelievable amount of money. And that's the part that it's already at $500 billion. You know, where's it gonna go next from here? And so that's why I wanted everybody to be aware from A to Z, meaning like the exposure I got, and now that I see the suicide is ridiculous. The amount of young children, I call them children, they're adults, I'd say probably 19 to 22. We probably get 100 a year, where they're in a college. The girl, 2 nights ago I saw a girl from La Roche. Last week I saw somebody from Chatham, it was called. So like it's around. Good that we have the resources. Remember, we're the crisis center. So these people are making the call because they're feeling like they might hurt themselves or having bad thoughts. We're the crisis center, so that's why we're getting that volume. But that's why I'm making you aware. This is amazing to me that these are intelligent people that are at that edge. And remember what I talked about with the stressor. And then also I still think the cell phones are part of it. You know, my children were all home for Easter, and you know, I wouldn't talk to them. They're like, Dad, I'm talking to you. No, you're not. You're using these, you know, like they're on the cell phone while they're talking to you. You know, it's like it's all part of who they are and how they are. And again, guys, all that information comes flying through. I don't know if you guys text, but like when I text, say, my wife, I'll finish texting, and then maybe within a minute, I'll get a text back. When you text, my kids are in their 30s, 20s and 30s. When you text them, you get an immediate response. Like I don't even flip the phone down, and I'm already getting a response. So they're used to that fast stimuli. What's it doing? I don't think that we know, but I do know the data shows depression, anxiety, and the panic attacks. Like I told you, this lady's in her 40s, hadn't had one since she was in college. The stressor she went through triggered it. I'm showing you that's normal. You know, the ones that we listed are pretty popular. That's why I put them up there. Those are the ones that we see. And the exacerbation of any of those usually comes from not taking the medicine or a big stress. Loss of a loved one in the family, you know, accidents or different things happening. All right? Last thing I leave you guys with. This is Joe. All right, guys. Now we talked about, I showed you the side view of the thalamus. And I talked about a stressor. There are ways to lessen your stress that take 10 minutes. And I'll give the information to Karen. It's a frequency that's free. It's a free app on your cell phone. I did it. That's the only reason I'm telling you to do it. You put these earphones in, earbuds I think they call them. It sounds like it's not music, but it's pleasing like music. Like it'll be a different sound, different pitch, louder, softer. It relaxes you like you can't imagine. And it's free. I think what they're gonna do is give it out free to everybody and then charge so that you buy it down the road. Because that's all I kept thinking is why would they give it out to everybody free? But that's probably the concept that if they give it out to enough people and it works, people are gonna pay for it. So again, guys, please, just like I said, what I saw with marijuana and the drugs, stress is the biggest factor that I've seen with mental health disorders over the last 5 years. And the volume, guys, is busy. It's so, I mean, that's the other part I didn't realize until I did this. I mean, any given night, we got 30, 40 people in there, and sometimes more. And a lot of times they're even in the ER waiting to get placed because it's a crisis center. You know, and if they already have a psychiatrist that say works in, you know, East Liberty area, then they would send them out. But they do that intervention so we see them all. And that's why, again, I wanted to make sure we did this so that there was an awareness to, and like, I don't like cost. That's what everybody's doing today. If you're in a network, which I'm still independent, but if you're in a network, they look at the cost. So just look at the cost. It's $500 billion today. Well, that was 22 data, $500 billion in 22. And it's not getting better, it's getting worse. Why? No one's talking about it. No one's talking about the suicide. No one's talking to friends, families, whoever. Do you know anybody that committed suicide? You know, like those are the kind of things that are just incredible. And then, like I told you, my son, he went to Kiski. You know, it was a private school, and so I thought, well, that's what it was. Like these kids were just rich, spoiled little brats or whatever. Tried to place it in my mind. Well, then no, his buddies that didn't grow up wealthy, also are taking their life. And then the websites are what bother me. Like, you can get on a website and they'll talk it up as if it's a good thing. So please be aware that this is going on. Please be aware of the top 5 that I listed, because we're seeing people have real problems. Post-COVID did do a lot. I'm not saying it didn't, guys, but I told you in 19, and even in 19, just the stress. I would say the students are what got me. Like, when you get a 19-year-old from some other state coming in talking about how they were just stressed out and they couldn't handle it and they just wanted to come in because they were thinking of hurting themselves. You know, that gets your attention. And that's why I wanted to project it out to you so everybody's aware. Okay? Good. And by the way, just reminded everybody, I was on time today. I found a new way. I'm taking a new bridge. Any questions? Yes?
This ADHD, I have a grandson, but when he was younger, he had it. Do they outgrow that?
Depends on the underlying cause. Can they? Yes. You know, but I hope he sees and talks to somebody, because that's what it requires. You have to have ongoing discussions, and then you have somebody, the people, like, it's almost like the psychoanalysis I talked about. The people that do it well really get to know the person. So they're able to say, like, look, this is stressing you out, this is stressing you out, this is stressing you out. Because those things are going on, you got too much on your plate. So your attention is a little bit off because all this, you have to back off of some of those things. And it takes time.
He's a dad now.
Well, it's still, like, it stays with you as you see. I mean, it can't. But I think what I've seen mostly in my practice is the people that I refer out, that's the biggest thing you see, is they talk to the psychologist about their daily routine and how much they put on their plate. You know, like, for me, since I don't have Joanne and Homeo every day, everybody thinks I can't even get here on time, right? But it works out. You miss them, but you figure out ways to go around it. You know, but the point still comes back to, you know, can they grow out of it? Depends on the cause. And if it's a big stressor, bullying, we'll talk about that. I think that's coming up as a topic. Bullying is ridiculous, ridiculous. What kids go through today, oh my goodness. And I was little. I got picked on. When I graduated from Kiski, I was 4'11" and a half and 98 pounds. That's what people say, what the hell happened to you now? But the point is that you get picked on, and it's amazing. It's just terrible. And that, I think, leads to that conflict. That conflict may stay. What stressor comes up to trigger something, it happens. But they need help. That's the other part of it. And the help's here. Please make sure, guys, anybody, call any number, anywhere, any hospital. May I have the crisis line? Boom, they put you in touch. And I'm talking quick. They put you in touch with somebody. And these are genuine people. You pick that up while you're on the phone. It's not someone trying to sell you something. This is somebody that honestly cares, and they want to talk to you about whatever's going on that you want to talk about. So please take advantage of it. Any other questions, guys? Good, thanks for having me. And I was on time.
Hey, excellent. Hey, that's excellent. Thank you.
I don't know where it went.